Designed to answer the question, what does this mean for clinical practice? Each text module, printer-friendly and downloadable, provides a concise review of the latest oncology research advances to address identified educational needs or interests. Expert commentary provides context for integrating evolving evidence into clinical practice and treatment planning. In addition, each R3 can be supplemented with a downloadable PowerPoint slide set that can be utilized as a self-study or teaching resource. The survey will ask questions to live meeting participants that are the most pressing concerns related to best practices and clinical controversies in the management of a specific topic tumor type. Survey data is summarized and compared to evidence-based guidelines with expert commentary on deviations between clinical practice and current guidelines. Designed to capture the most commonly asked questions during local and regional meetings, these text modules, printer-friendly and downloadable, allow clinicians to place current and emerging evidence into clinical perspective to optimize patient outcomes. Evidence-based data and expert viewpoints are interspersed to address top-line questions asked by clinicians. Highlighting important advances in a given malignancy, these educational manuscripts are authored by thought leaders and submitted to peer-reviewed journals as standalone articles or supplements. The manuscripts place emerging data into clinical context to help clinicians understand their relevance and determine how best to integrate them into practice.
I'm Dr. Livia Scheller, and I'm the Medical Director at the Institute of Medical Education and Research. We are reporting to you live from the
Recorded during major oncology meetings and conferences, these thought leader interviews address the implications of cancer research advances. Expert commentaries provide much-needed guidance on the application of the latest evidence in the practice setting. Discussions are transcribed and can be adapted into text modules for print or download. Grand Rounds provide a forum for clinicians to stay abreast of the latest developments in evidence-based medicine. Designed to address ongoing controversies and clinical debates through interactive discussions, these activities provide access to thought leaders who not only present evidence-based updates and challenging cases, but also offer expert insights and advice on best practices. The challenging cases are designed to demonstrate the practical application of emerging science into treatment selection. Pointed questions are posed to the participants by the faculty presenter to facilitate interaction and foster peer-to-peer learning. These activities are scheduled at nursing society chapter meetings, academic institutions, and community healthcare centers to reach nurses in their home practice environments and directly address and close competency and performance gaps. Pointed questions are posed to the participants by the faculty presenter to facilitate interaction and foster peer-to-peer learning. Senior professors engage fellows in discussions that analyze underlying disease pathology, evolving data, and optimal treatment selection. Pointed questions are posed to the fellows by the faculty presenter to facilitate interaction and foster peer-to-peer learning. The lectures are developed to supplement clinical training and provide perspective on the challenges that healthcare professionals face in daily practice, thus fostering clinical competence and performance. Mentorship programs are offered to support professionals in disease state knowledge, confidence building, and transitioning to further education. Moreover, they are designed specifically to bring education and resources to underrepresented populations with unmet educational needs. Formal lectures, hands-on workshops, virtual meetings, and self-study and assessment activities are used to foster clinical competence and performance and encourage mentees to adopt mentoring in their ordinary practice. Mentors are paired with a set of mentees, usually no more than 3, who have passed a rigorous application process. At the end of the program, the mentees host their own lecture presentations in order to assess their progress and determine whether they have graduated to the level of disease state expert, educator, and mentor. Clinically relevant evidence-based conferences are designed to align practice behavior with current clinical guidelines and evidence to improve competence and patient care. These activities are information-intense sessions held across the United States at academic institutions, community healthcare centers, and other meeting venues. Participants are engaged via audience response questions, breakout discussions, and/or clinical debates. The aim is to further familiarize participants with clinical methodologies, using the examples of practical problems that occur in practice and optimal strategies for their resolution. These online interactive branched logic activities are designed to challenge clinicians to work through a patient case by making a series of treatment choices. After each choice, the participant is presented with the outcome of the decision and offered another set of choices, thus requiring those who made a suboptimal selection to work through the consequences of that management decision. At the conclusion of the case, the faculty discusses the key decision points and reviews evidence-based data that support optimal treatment selection. In-service videos offer a unique alternative to traditional case study delivery. Clinical setting reenactments provide real-world simulations of patient and healthcare provider discussions regarding diagnosis and treatment planning. Incorporating audience response questions to engage participants in treatment selection, the videos also include commentary from faculty moderators who discuss the latest emerging evidence that supports the rationale for optimal treatment selection. Downloadable slide sets are designed to complement live meeting activities as a supplemental educational resource. Slide sets are perfect self-study tools and a great resource for educating others. All slide sets include fully referenced speaker notes to give the featured data clinical context. Slide sets may also include an education training guide that serves as another tool for educating others. Pre-recorded didactic presentations are enhanced with interactive discussions of challenging cases and faculty-moderated Q&A. The archives include access to the speaker's downloadable slide sets and a recording of a complete webcast, giving participants on-demand access to the content. IMER webcasts use advanced internet technology to deliver the highest quality education via live and/or pre-recorded activities. Didactic presentations are enhanced with audience response questions, interactive discussions of challenging cases, and faculty-moderated Q&A. Live webcast participants are able to engage with the speaker by submitting questions and comments in the same capacity as those in attendance at the on-site meeting. Webcasts are complemented by access to the speaker's downloadable slide sets and a recording of the complete virtual meeting, giving activity participants on-demand access to the content. Held in conjunction with annual scientific meetings and targeted to reach meeting participants, the symposium is independently organized and offered by IMER. Didactic lectures are supplemented by interactive case discussions, which are used to facilitate interaction between the faculty and participants and foster peer-to-peer discussion. In addition, participants receive clinical assessment and management tools for use in practice. Satellite symposia may be delivered as webcasts to accommodate those who cannot attend the live meeting. An interactive, nonlinear learning platform designed to deliver demonstrable return on learning through one or more activities with common educational objectives. Participants navigate to specific activities through the workshop landing page that contains a table of contents with associated links, run times, and task credits. Information on how to obtain credit is also provided. Upon completing an activity, the participant is returned to the workshop landing page to encourage continuation with the curriculum. A topic tumor-specific CME-CE accredited newsletter highlighting timely and important educational program content based upon a symposium. This newsletter is designed to further expand the reach and distribution of the educational content beyond those able to attend the live meetings. These newsletters will be made available for on-demand viewing and/or as a supplemental insert to a peer-reviewed journal. CME-CNE accredited research highlights summaries that will provide a review of cancer data updates as presented at major medical conferences. These research highlights will be made available for on-demand viewing.